So before we show you the muscles, I just want to remind you, because when you take muscles off, it's a little bit hard to tell what's the front, the back, the side. So make sure you always look for your landmarks. The front of the lower extremity, obviously you're going to look for your kneecap, which is the patella, and the toes. That's easy. The lateral part of the upper extremity, you're always going to try to find this band right here. This is the iliotibial band, right, or ITB. That's always going to be on the outside, the lateral aspect. Posterior, the back, always look for the hollow area right here. That's the popliteal fossa. That's always going to be in the back. So just so you know. All right, so let's start at the top. We'll go over some of these muscles here. At the top, right here, here, and this tendon right there, these three muscles make up the iliopsoas. Iliopsoas. We kind of come around this way on the lateral aspect of the leg. This short little muscle right here going into the iliotibial band, this is the TFL, tensor fascia latae, iliotibial band. And we come back over here, this is the glute max. This one here is the glute medius, right? So gluteus maximus. We're going to take that down a second, and that exposes the gluteus medius. Underneath this would be the minimus, the gluteus minimus, but we don't see that on this dissection. The other muscles here that you want to be able to identify, there are 6 muscles underneath the max. So if we take the max off, the first one you're going to find is piriformis. That's always above the sciatic nerve, so that's how you're going to find that, piriformis. And then you're going to do your acronym GOGO. Gemellus superior, obturator internus, gemellus inferior. The next one should be the obturator externus. We don't see it on this dissection, so I really can't ask you about that. And then the last one is the quadratus femoris. Remember I told you the little acronym, please, go quietly, right? Please is the piriformis. Then you have your 4 GOGO muscles, which would be here. And then Q would be the quadratus femoris, right? That's the quiet leg. All these muscles turn the leg out. They're lateral rotators. Okay, so that's that. Let's do the muscles on the let's do the muscles on the front of the thigh next. So we're looking at the front. We see the kneecap. We see the toes. This long muscle right here that goes around, spiraling like a snake. This is the sartorius muscle, or the Taylor's muscle. Right? So that's the sartorius muscle. We'll take that off a second. The remaining muscles in the front, right here's the kneecap, the remaining muscles are the quadricep group. So this first muscle here, rectus femoris. Then on the inside, vastus medialis. And then on the outside, this big one here, vastus lateralis. The third vastus is under the rectus femoris, so we have to take that off. So if we pop that off, right, that would be this muscle here, running straight underneath the rectus femoris. That is the vastus intermedius. Okay, so the quads, 4 muscles, rectus femoris, and then 3 vastus muscles, medius, lateralis, intermedius. Inside the thigh. So we're looking at the inside of the thigh now. The first muscle, probably the easiest one to see, the most superficial, is gracilis. Behind the gracilis, this big muscle right here, adductor magnus. And then in front of the gracilis right here, adductor longus. Right, so find the gracilis, then there's a muscle behind and a muscle in front. The magnus behind, the longus in the front. And then finally, the last one that we can see, right under the pubic bone right here, here's the pubic bone, pectineus. Okay, all of those are your adductor group. They bring the thighs together. The hamstrings. Right, so here's the lateral side. Hamstrings are in the back of the leg. Again, you can see the back because we have the popliteal fossa. 3 muscles here, guys. The lateral muscle here is the biceps femoris. Again, that's closer to the iliotibial band. So here's the iliotibial band. So the one next to the iliotibial band, right there, biceps femoris. And then the other 2 muscles on the inside are the semis. The most superficial one is the semitendinosus, right there. If you follow it down, follow it right here, but the stick going down, you see this long, thin tendon right here. That's all semitendinosus, right? Thin tendon. Deep to that muscle, broader and deep, is the semimembranosus. So here, I can see the semimembranosus. It's underneath the semitendinosus. We see it on this side a little bit, and then I see some over here also. Okay, so it's deep and broader. This was the semimembranosus. Semitendinosus would sit like that, superficial and more narrow. Okay, that's everything in the thigh. Then we have the leg. So the leg is divided into 3 compartments. The front compartment is the anterior compartment. On the outside, again, this is the outside. This is the lateral compartment. There's 2 muscles. And then in the back, posterior compartment, 7 muscles. Okay, so let's start with the anterior compartment first. Find the tibia first. The muscle right next to the tibia or on the tibia is the tibialis anterior. Right here. The one right next to it, guys, extensor digitorum longus. And then the only other one I'm going to have you do, on the big toe, this tendon right here, stand on top of the toe, going right up this way. The belly is between these 2 muscles, so we really don't see that. That is the extensor hallucis longus, right? It's the big tendon on the top of the toe. So that's the anterior compartment.